Tinnitus caused and influenced by the somatosensory system. The tinnitus caused and influenced by the somatosensory system refers to a subtype of tinnitus where sensory signals from the somatosensory system, which includes sensations from the skin, muscles, and joints, play a role in the perception and modulation of tinnitus. This type of tinnitus is often referred to as somatic tinnitus or somatosensory tinnitus. Understanding the interactions between the auditory and somatosensory systems is crucial for diagnosing and managing somatic tinnitus effectively. Mechanism of somatosensory influences on tinnitus. The somatosensory system and the auditory system are closely interconnected with overlapping neural pathways and shared brain regions involved in sensory processing. Somatosensory inputs can modulate neural activity in the auditory system through direct connections or cross-modal interactions, influencing the perception and characteristics of tinnitus. Dysfunctional sensory processing in the somatosensory system, such as changes in muscle tension, temporomandibular joint (TMJ), dysfunction, cervical spine disorders, or dental pathology, may contribute to the development or exacerbation of tinnitus. Common triggers and contributors. Several factors related to the somatosensory system may trigger or exacerbate somatic tinnitus, including temporomandibular joint (TMJ) disorders. Dysfunction or misalignment of the TMJ, which connects the jawbone to the skull, can lead to muscle tension, jaw clenching or grinding, bruxism, and may influence tinnitus perception. Dental pathology. Dental problems, such as malocclusion, dental trauma, or temporomandibular joint disorders, can result in referred pain or sensory disturbances that affect tinnitus. Cervical spine disorders. Conditions affecting the cervical spine, such as cervical spine arthritis, disc herniation, or whiplash injuries, may lead to muscle tension, nerve compression, or sensory disturbances that influence tinnitus perception. Muscular tension and trigger points. Muscle tension, trigger points, or myofascial pain syndromes in the neck, shoulders, or temporomandibular muscles may contribute to somatic tinnitus through sensory interactions with the auditory system. Clinical manifestations and assessment. Somatic tinnitus may present with specific clinical features or characteristics that distinguish it from other forms of tinnitus, such as changes in tinnitus pitch, loudness, or location in response to somatosensory stimuli. Patients with somatic tinnitus may report fluctuations in tinnitus perception associated with movements of the jaw, head or neck, or changes in posture. Clinical assessment of somatic tinnitus typically involves a thorough history, physical examination, and evaluation of somatosensory and musculoskeletal factors that may contribute to tinnitus. Diagnostic tests, such as imaging studies e.g. MRI, CT scan, dental examination, or electromyography (EMG), may be indicated to identify underlying somatosensory pathology or related comorbidities. Management and treatment. Management of somatic tinnitus focuses on addressing underlying somatosensory contributors and modulating sensory inputs to alleviate tinnitus symptoms. Treatment strategies for somatic tinnitus may include TMJ therapy, conservative measures such as jaw exercises, physical therapy, occlusal splints, or orthodontic treatments to alleviate TMJ dysfunction and reduce associated muscle tension. Cervical spine therapy, physical therapy, manual therapy, or chiropractic manipulation to improve cervical spine mobility, posture, and muscle function and reduce associated tinnitus symptoms. Trigger point therapy, myofascial release techniques, trigger point injections, or acupuncture to relieve muscular tension, trigger points, or myofascial pain, contributing to somatic tinnitus. Behavioral interventions, relaxation techniques, stress management, cognitive behavioral therapy (CBT), or mindfulness-based therapies to reduce anxiety, improve coping strategies, and modulate tinnitus perception. Interdisciplinary approach. Managing somatic tinnitus often requires an interdisciplinary approach involving collaboration among otolaryngologists, dentists, physical therapists, chiropractors, pain specialists, and other healthcare providers. Comprehensive evaluation and treatment of somatic tinnitus should address both auditory and somatosensory contributors to optimize outcomes and improve quality of life for affected individuals. In summary, somatic tinnitus caused and influenced by the somatosensory system involves complex interactions between sensory inputs from the somatosensory and auditory systems. Understanding and addressing underlying somatosensory contributors are essential for diagnosing and managing somatic tinnitus effectively. By targeting specific somatosensory triggers and modulating sensory inputs, healthcare providers can help alleviate tinnitus symptoms and improve overall patient well-being.